Welcome to the HealthFlo Podcast. I'm your host, Jean Armand. Join me weekly as I share health information that will educate and inspire you. Please consider supporting this podcast by listening, subscribing, and rating. You can also support future episodes by making small monthly donations. Once again, welcome to the HealthFlo Podcast. Welcome to episode number 27 of the HealthFlo Podcast. It's my pleasure to have Mr. Patrick Carter in the house. Hey, Patrick, good morning.
Good morning.
So, like I was explaining to Patrick, this episode is going to be, it's very personal to us. I'm looking forward to the conversation. It's a story that needs to be told. And it's really about Patrick, his life, his wife's story, their life story. And as we get into it, you'll understand. So without any further ado, Patrick, welcome to the HealthFlo Podcast.
Thank you.
So I'm going to start by just asking you to introduce yourself. Well, first of all, I'll start by saying I know Patrick through his wife, Dr. Latonya Hendricks. We met in the emergency room, and I think we met in the emergency room at, I forgot what hospital. What hospital did she first work at?
AMC.
Yes, AMC, and then we moved to Noonan.
Correct.
I mean, she was a joy. She's a great physician, so personable. We loved her. She's just like so lovable, always smiling. We loved her outfits she wore at work. She wore her scrubs, and every single day she wore a different pair of sneakers. All right. So that's my girl right there, Dr. Latonya Hendricks. So we're going to talk about her life story with Patrick. So Patrick, how did you meet Dr. Hendricks?
It was the summer of our senior year in high school.
Oh, wow. Okay. And so you guys met, and was it love at first sight, or, what happened? How did the relationship?
Well, at the local YMCA, she and her best friend were counselors, and I was a lifeguard.
Okay.
And just going through taking care of all the kids come to the pool, the counselors bring them to the pool. My brother and I saw these nice two young ladies, who were counselors. Of course, women with their baby suits on, they always had on shorts. So it was always a topic of a conversation. Why you guys clothe yourself so much? And I mean, we understand you got to do it. You got a lot of kids around,
Right.
but that sparked my interest and introduced myself. I think we went out on a group date with all the counselors and the lifeguards to the movies, and pretty much the rest was history.
Oh, wow. The rest was history, meaning so you guys continued to date. And when did you get married?
2014.
Yes. August, right?
August 2014. August 17th, 2014.
August 17th. Yes, I remember, just all the planning and the talking and the shopping and the different things and all the beautiful pictures. So you guys get married August of 2014, and then what happened next in your life?
Pretty much life began. It was kind of a rough transition between med school, actually landing a job, moving back home, finding, just stable housing for the both of us, because we weren't married at the time that we moved in together, but we made the best decision for what we thought our life was heading in that direction. Ended up renting a house first. In turn, maybe right after marriage, we purchased our first house.
Yeah.
And she ended up getting a promotion and moving down to Noonan. And so, I mean, that's where life pretty much began for us.
Okay. Yes, I remember that. And I was happy when we both made that transition to Noonan. Just, you know,
Mm-hmm.
just a familiar face, and I know how great she was as a physician. So, so I know that early on during this time, you became ill, right?
I did. I did. It was pretty much all of a sudden. We were fine. Like I tell a lot of people, really, between the two of us, no family histories of anything.
Mm-hmm.
It was just kind of out the blue. I remember distinctly we had a Super Bowl party,
Okay.
and I was out, just facilitating parking and trying to get everything together after the party ended. And I just felt kind of weird. And of course, how can I explain it? After everyone left, we decided to watch a movie, and she just happened to turn and look at my neck and saw maybe a bump about the size of a pea on my neck. And she was like, we need to go get that checked out. So we went to our family physician,
Okay.
and the family physician recommended we go to Piedmont Fayette just to get it checked out.
Okay.
No alarms or anything, but I mean, ultimately ended up being cancerous. So she saw a bump on my neck, and we went to the family doctor. Doctor did what I guess her prototypical thing she do just to check for cancer stuff.
Right.
And she couldn't figure it out. So they sent me over to Piedmont Fayette, and that's when the process began for me as far as biopsying and trying to check and see what the issue was at first.
Right.
And it was just due to her just being able and knowledgeful to know that wasn't right. So
Mm-hmm. So then eventually you get diagnosed with non-Hodgkin's lymphoma.
yeah, so Dr. Bender, who's both of our oncologists, and our family practice doc, they called both of us in and let us know. And they led with, we have a plan for this, we could fix this. And I pretty much responded with, let's get started.
Wow, wonderful. So you're married August. Super Bowl's usually February, so this is around in February you get diagnosed.
Okay, yeah. So we're married in 2014. This happened February of 16.
Oh, okay, 2 years later. Wow, I didn't
Mm-hmm.
even realize so much time had gone. It just seemed like it's been one lump of events that
Yes, it has.
I don't remember the other time in between. That's the thing.
Mm-hmm.
That's one thing. All right, so you say let's get started, and what happens?
Unbeknownst to me, Latonya's very emotional. And I was more keen on trying to fix it. So if it could be fixed, I was hell bent on trying to get it done.
Right.
Not really sure if most viewers or people know the process of, just cancer treatment itself. You have to go get so many surgeries. You have to make sure it's not in your bone marrow, your brain, and things of that nature, your sacrum. It's a whole slew of things before you could get started. And normally it's like a timetable. So you have to go do one thing, you got to go do another. But between Dr. Hendricks and Dr. Bender, they work close together. They kind of hustled mine along just to make sure we got the proper care and whatever we needed to do to go ahead and get me situated.
Right.
And one of our biggest issues were fertility, and if it would be a problem, if we could still conceive, because I ended up doing 9 months of chemo and radiation.
Mm-hmm.
And so that was Dr. Hendricks' concern at that time. And of course, right after I got ill, she went and got checked out, and she was just fine.
Mm-hmm. So let's just slow down a little bit with what's your understanding of non-Hodgkin's lymphoma?
What's my understanding?
Yes.
Mine was non-Hodgkin's lymphoma T-cell.
Mm-hmm.
And so my understanding of it was I was in stage 2.
Mm-hmm.
and it had yet to spread to any of my other vital organs. And they presented me with this plan of the chemoradiation to combat the disease,
Right.
and with a study regimen that I would be okay.
Okay. So then you started that plan.
I started the first week of March.
Okay. March of 2016.
Correct.
Okay. All right. And you go 9 months with that?
Yes, ma'am.
Yeah. And how was that?
At first it was tough, but realizing I have so many loved ones around me, family, friends, they supported, and me being as optimistic as I am, I just persevered through it. Like Dr. Bender will tell you, I was one of the many patients that never got sick, that never threw up throughout the whole entire.
That's amazing.
Just the cancer situation. I don't know if it was because my mind was so busy on something else, or I just knew I had to get well. But I was very able. I used to, do 6 hours of chemo and go play 9 holes of golf. I was very weak, but I just had the tenacity just to keep on keeping on, because that's just what we do as humans in life.
Right. And like you said, it was classic because non-Hodgkins lymphoma does present like lymphadenopathy. So in your lymph nodes. And that's why when she saw that, and especially, it's one thing this is what I usually tell people when lots of patients come into the emergency room and they're like, my lymph nodes are swollen. If you are ill, that's fine. If you have a sore throat, it's not unlikely that you have swollen and tender lymph nodes. If you have infection in your belly, then the ones in your groin may be enlarged and tender. But what the concern is, there's no illness, you have no sort of infection, and then you get an enlarged lymph node that's not even necessarily painful. It's just something that's there. That's the big difference. And just so our audience know, those are the signs and how to differentiate.
Yeah, because I wasn't ill. I didn't feel ill at the time.
Exactly. So it's just something shows up and it doesn't make sense. Our lymphatic system is our garbage disposal. So whenever you get infection, so say you have infection on your chest, then the ones in your axilla under your arms may be the ones that are enlarged and painful. That's appropriate. It's when it's not. Yeah, like you said, she just saw this thing on my neck and there's no reason for it because I'm not sick. Right. Okay, so yeah, you are one of the wonderful people that went through chemotherapy with no problems. That's awesome. That's awesome. So walk us through that process of you getting through chemotherapy.
Well, it's a lot of needle work, blood work often, the platelets check. Let's see, it's a way of life. I try to explain to people, being diagnosed with cancer and just the treatment regimen is a handful.
Yeah,
and it's very repetitive.
Yes, you're spending hours at an infusion center, getting the medication. You have to be monitored carefully just in case you may have a reaction. Everyone is different. I mean, they do make a cocktail according to your diagnosis, but we really don't know who's going to be allergic to what. It's not until a person actually is getting it. And also, like you said, the reaction. People lose hair, they have bleeding because it wipes out their platelets. It actually kills everything, good and bad cells,
Yeah, my dad described it as a jump start for the body, just like the car.
Yes. It just wipes it out and, allow the bad cells to be killed, and then new ones just like come on up. So that's why even with the hair loss, we know that, most people get their hair back. Did you lose any hair?
I did.
You did? Okay.
My side effects pretty much was hair loss and weight loss. I probably lost in essence of about 60 pounds.
Wow. Just from the medication, I'm sure.
Correct.
Loss of appetite. Did you have?
Uh, yes, loss of appetite, but
Mhm.
the diet I was on was more insure based
Yeah.
than actual physical food.
Hmm. So you go through your 9 months of chemotherapy, and what happens next?
Well, it was not I made it 2 months
Hmm.
through my regimen before life happened again. So pretty much me being diagnosed, Tanya and I talking about, starting our family.
Hmm.
Of course, we were trying to hustle up and try to do that before I even began chemo.
Okay.
And got to a point where I started, and 2 or 3 months later, she presented with the signs of being pregnant.
Yeah.
So me being pretty much first time father, all this is new for us. I bought 22 pregnancy tests.
No, you didn't.
I bought 22 pregnancy tests. 20 of them said they were positive and 2 said they were negative. So I told Tanya, just go ahead and make an appointment. Let's go see the gynecologist.
Okay.
And she's excited. I'm excited. In the interim, I'm still doing my regimen with the chemo. And so we finally, I say March, April, May is when we go see the gynecologist. Pretty much get there and they bring us back and they bring me back. And then, I bring the father back and say, hey, we're going to do ultrasound, let you see your fetus and things of that nature. We get back there, did the ultrasound, but unfortunately we couldn't find the fetus. So immediately the gynecologist was like, well, your blood work shows that you're pregnant, your urine samples show that you're pregnant, so maybe the fetus is stuck in the fallopian tube or something of that nature. So this is when everything started to shift toward trying to figure out what's going on. And they end up doing a CAT scan, and that's when they found that she had colon cancer that had already metastasized to her liver.
Wow. Yeah.
And we found that out in May.
While you're still under therapy.
Correct.
So in the interim, I work with, so that's your personal life. So I'm at work, and I specifically remember one day, this is how I found out with her. Um, One day she came to work. She looked like she had probably lost a couple pounds, and we were into, trying to lose weight and all that kind
Mm-hmm.
of stuff and being, best help. She was dressed in all black. She usually wear black with just a different,
Colored name stitching.
right,
Mm-hmm.
different color name stitching. It was just something. We were right at the at like the doctor station where we sit, and I saw her, and the look on her face was different. I said, Latonya, what's wrong? That was the first thing I said. And her eyes welled up with tears. Now, that's extreme because she's happy go lucky,
All
laughing
the time.
all the time. Miss Joker. I mean, the biggest smile. Oh my God. So I was like, come on, let's go. And we went into the I don't want to say locker room, but something like a locker room. I can't even think the name. And so she said, I said, what's wrong? And tears were flowing down. And she said, well, I had a positive pregnancy test. I thought I was pregnant, but it looks like I'm not. They can't find a baby. So now I'm going to be worked up. I'm thinking, worked up for what? Like, worked up for what? Like, what's going on? And from there, it was just, that's where our side of it, then, of course, she's a private person, and I didn't really hear much after that until one day. I was going through some things. I think I was going through a divorce then. So I actually left that hospital, and she called me one day because Raven another close friend said, you need to call Jean. And she called me. And I can remember she called me and she's like, I have to tell you something. And I'm like, what? Just in total, I'm just totally floored. I go into my closet. I'm talking to her from my closet with the door closed so she could tell me. And then we're just praying and just praying for the best. So go on. So you go to the doctor and her workup begins. And CAT scan says she has colon cancer that has already metastasized to her liver. And Latonya is how old at this time?
She is 34.
She's 34. She's healthy. That we all knew about. She was healthy, had a healthy lifestyle. She didn't really smoke or drink into any excess. She had gone to medical school, had gone to residency, and she was now a full-fledged emergency room physician, newly married. Her husband is diagnosed with Non-Hodgkins Lymphoma. You guys buy a house. I remember when she was excited about that. I mean, I know you know more than I do. She is Miss Planner, Miss Detail. Like she researches it and she knows every little, thing she's gonna do, and everything is going right in her life. And so continue on with her diagnosis.
So once she was diagnosed, of course, I step up again and say, "Hey, you guys had a plan for me. Do you have a plan for her? If I'm working diligently to combat this so-called cancer, she should be able to. So that's just my lack of knowledge of the medical field and what is more severe than others. And that's when she broke it down to me, explained to me that, hey, your diagnosis is 90% curable. And she explained to me that hers is only 8 to 12% curable. And that's when I was like, what do you mean only 8 to 12% curable? You're going to take the chemo and regimen just like I am, correct? And she explained to me that, no, it's not that simple. And she explained what it means when the cancer is already metastasized and grown and they're trying to control the tumors. And it was just, at that point, also just so real.
Yeah.
And not only trying to battle mine, comfort her, get her regimen started, it was just a lot.
Yeah. Because you're still getting treatments at this point.
At this point, I'm down. I'm in my 3-year stage. It's 3 to 5 years.
That point that she was.
At this point, yes. At this point, I'm full-fledged in. So it got to the point where I would go to chemo on Tuesday, turn around, go back to the doctor with her on Wednesday, do my follow-up on Thursday, start her chemo on Friday, and it was just like that, solid for about 8-9 months.
Yeah. Yeah. And I think it was that August that she had her first surgery, right? That summer was that 2016 then? I think.
Yeah, 2016, her first surgery. She started her regimen in June 6th of 2016. Did all her surgeries in June and July. And I think at the end of July, she had her first surgery.
Yeah. Yeah, I think. And that was also at Piedmont Fed.
Yeah.
At the same hospital that
we had the same oncologists, the same doctors, the same nurses. So every time they still see me today, it's just like, wow. We both were a breath of fresh air, and they can't understand. Like Dr. Bender said, he had one couple that both came in, both ill, with 2 different separate cancerous diseases.
Yeah.
It's just like,
how could it be?
How could it be? And, I ask all the hard questions, like, is it somewhere we live or somewhere we ate or somewhere we vacation?
Yeah.
And he was like, no, it was just unfortunate.
Yeah. We all asked the same thing, even amongst ourselves, like, because it was just unbelievable. It shook us to the core that she was even going through this. I mean, I know that there's not a person There's no one out there who ever has anything bad to say about her. Like, she's such a breath of fresh air, full of life. I mean, I've never seen a bigger, sweeter smile. And so smart, like so smart. My goodness. And just personable. Her approach, really, I wanted to do this to share the story and just to honor her memory. I mean, I loved her so. I think of her often. Yeah, I really do. I really do. So she has surgery. I remember coming to the hospital to see her. And then you guys were just going through chemotherapy, both of you doing it, on alternate days. That had to be a lot, Patrick.
Well, at that point, I just had to do what I had to do,
Right.
and realizing my cancer kind of takes a backseat to hers. I just, kind of sucked it up and just did what I had to do to support. And we had a lot of family help.
Yeah.
Her mom and her family moved in. My mom, my family, everybody pitched in. Everybody helped.
That's good. That's good. So then, at what point was it decided? Like, she goes through her treatment, and then what happens?
She did about 3 months of the recommended cocktail that they made for her, and upon those first 3 months, they realized it wasn't strong enough.
Right.
Then they tried another cocktail, and that didn't do anything either. Then we were presented with a couple of experimental drugs through, what was that? Piedmont, Northside. So we went up there, and they did, I can't remember the actual name of it, but it was an experimental drug that was going to try to aggressively attack the tumors to try to help them, and that kind of failed too. So ultimately, 6 months of trying at least 4 to 5 different regimens, and neither one of them were able to stop the aggressiveness of the cancer.
The aggressive growth, the growing, spreading of the cancer.
Correct.
Okay. And did they ever mention to you that this could be anything genetic? Like,
yes, they did. The oncologist suggested family members go get tested for, like, I think her dad or mom or sister, they all went and did colonoscopies and checked for polyps and things of that nature, just to check and see if it was genetic.
Okay. All right. But no other prior family member, as far as you know, had any?
Not as far as I know.
Yeah. Okay. And so it's 6 months, and then what happens?
A couple of, right before the experimental drug, she got a chance to go to Chicago and pass her boards. Her and her mom went up there, did that, came back, and I'm thinking,
for her boards.
Yes.
So you and her both are going through chemotherapy.
Right. And I told her not to go, and she you know how she is. She's strong and determined.
Yeah.
And she still proceeded to go ahead and make that accomplishment. And after that, this is about Thanksgiving, and I'm kind of oblivious to really what's going on at this point. So she was like, well, maybe I want to do this and I want to do that because this might be my last Thanksgiving. I was like, wait, what? So it took for me about Thanksgiving to understand how real things were. I mean, I could see the deterioration between the jaundicedness and the liver failure and just the toll that the treatment had taken on her.
Right.
And so we did family Thanksgiving with my family as was hers, and we traveled pretty much toward to Christmas, and her favorite cousin got married. We were planning on going there, and she actually got ill at the house. We had to call the ambulance, and they came out and admitted us into the hospital like right after Christmas. So between the 26th and the 1st of the year, Dr. Bender, which is our oncologist, he was out of town, and one of his peers were looking in on us while he was gone. And when he got back, he pretty much told us that there's nothing left that he can do. So we should start preparing for the worst.
Yeah. Yeah.
So that was right at the beginning of January, and they gave her 2 weeks in January to live, and she lasted the 29th.
Mm-hmm.
And she's now in heaven, you know, looking down, keeping on.
Yep. Yep. Just, I think after probably after you got that 2 weeks message, you started inviting, you know, her.
Okay. Yes, I invited any and everybody that ever loved
her closest friends to come and, you know, see her.
Mm-hmm.
Yeah, that was really, really hard. I saw her twice, and that was hard.
Mm-hmm.
Change from the person that I knew to where she was, but she was still all, you know, just peaceful and just as sweet as ever. Just sweet as ever. Gosh, it's a hard thing. I've never, you know, I've seen and heard of people. I actually had a young cousin who died he had lymphoma.
Mm-hmm.
When I was in college, he died. Maybe he was like 18, anywhere from 18 to 21, that age range.
Mm-hmm.
He lived in Canada, my aunt's son, but he passed away, even with treatment. But yeah, Latonya's death was really a loss for everyone.
Mm-hmm.
Her family, the medical community, just in general. She was an awesome person, and I love her just as if she's still here today, you know. So that was something else. And so she died January 29th. How
Correct.
many years is it going to be now?
That'll be 3 years this year.
3 years. And her going away service was tremendous. Do you even recall any of that?
It's kind of hard because I had a whole lot going on.
Yes, yes.
And I was just trying to stay focused and trying to do what I think she deserved.
Yes. And you did a fantastic job. You really did. It was beautiful. It was beautiful. So how are you? How's your health now?
Our health is wonderful. Like I was telling you, I'm still in that 3 to 5 range. I went from 4 times a month to 2 times a year to now once every year.
Uh-huh.
Still dealing with Dr. Bender, but unfortunately, you know, WellStar change took over Piedmont Noonan, so I'm still dealing with insurance and things of that nature. But we stay in touch, and actually coming up on my checkup in February, so they'll let me know how I'm doing. But other than that, I'm back healthy. I'm out here trying to keep on keeping on.
Yeah. How's life in general?
Hard.
Yeah.
Life is hard, and I pretty much just give it up to God. I know it's a purpose as to why I'm here, and I just roll with that, and I stay focused on life and what He has done for me,
Right.
and continue to do His will and His bidding.
Right.
Knowing that I'm doing the right thing.
Right. How do you honor her memory?
I visit a lot. Memories, videos. Sometimes I get a little selfish because I keep them all to myself, but I should do more of sharing. But it works for me. You know, that's my little angel on my shoulder, you know, when I'm stuck in between decisions and just want to know what to do. I always say, what would Tanya do?
Right. Awesome.
So that gets me through a lot.
I'm sure. Wow. From the time you met her to being married to her death, I mean, I know you could never have fathomed any of it.
No, life wasn't supposed to work like that. But I found out how so real it happens. I mean, life happens That's
Yes.
why I encourage people daily, love the people that love you. Try
Yeah.
your best to do the right, because tomorrow's not promised. And I literally mean tomorrow's not promised.
Exactly. Exactly. And that's the whole, if nothing else, if no one else gets any of this, is just to live full lives,
Hmm.
love completely and freely,
Completely. Hmm.
because tomorrow just is not promised. So that's amazing. Well, I honor her. I love her. I love you, because
Thank you.
if she
And we
was
love you.
connected to you, that's good enough for me.
Hmm.
And I'm so thankful that you did this podcast. So thankful.
Thank you for the invite.
Absolutely. Keep on living, okay? And just we'll
Yes,
stay
ma'am.
in touch. All right.
I'm
God
ready to
bless
get on
you.
those bikes with you.
Oh, yeah.
Thank
Come
you. Love you.
on. I love you too. Yeah, you got to ride. I'm doing the MLK ride, not his birthday, but the Selma ride in February.
Okay, February the what?
It's February the 22nd, that weekend after Thanksgiving, after
Okay.
Valentine's Day weekend.
All right. I got to practice, but I'll
Well,
definitely be.
even if you don't do that ride, the invite is, did you buy a bike yet?
I did.
Okay, so this summer we're
I'm
gonna
over
run.
off Veterans Memorial. We're doing the little trail over there, the little Comet Trail. So
Oh yeah, that's the one. Okay, so we're gonna at least start with that. And July 4th, there's the 400 ride too. You can register for that.
okay.
Georgia.
I will register for both.
All right, love you, Patrick.
All right. Love you
See
too.
you out there on the trail.
Yes, ma'am.
God bless.
God bless you.
Are you thinking about starting your own podcast? If so, Anchor is the easiest way to make a podcast. Let me explain. Number one, Anchor is free. Anchor has all the creation tools that allow you to record your podcast and edit it right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, Google Podcasts, and many more. You can make money from your podcast with no minimum listenership. Anchor is everything you need to make a podcast in one place. Download the free Anchor app or go to anchor.fm to get started. Thank you for listening to the HealthFlo Podcast. Your support is much appreciated. It is my goal to share health information that you find helpful. Email topics of interest to the healthflow@gmail.com. Follow me on Instagram at @thehealthflow, also on Facebook at The Health Flow. Don't forget to subscribe, rate, and share. Until next time, keep your health flowing.